All right, we'll go ahead and get going. Good afternoon, everyone. Thank you for joining us on our weekly Zoom call. My name is Melinda Skirvin, and I am the Divisional Vice President for Five Star Senior Living and the Board Chair for Florida Senior Living Association. So let me give you the latest numbers on COVID. 1,487 residents are positive, and that's down 535 from last week. So another good decline. Staff numbers this week were 3,063, and that was down 210 from last week's totals. So we're making lots of progress, keeping these numbers at a low level in our communities. So please continue to be diligent and watch for any signs and symptoms, both in your residents and your team members. Jason, can you give us a quick update on last week's long-term provider conference call?
Absolutely, and thank you, Melinda. So from last week's call, we did learn that the positivity rate is remaining stable over the last 2 weeks, 4 to 6%. As we are entering into the new fall season, and up here in Tallahassee, the first day of cold weather, everyone, you make sure that you're taking the time to get your individuals, get your residents and yourselves caught up on health care that has been delayed, doctor visits, cancer screenings, flu shots, etc. And with that, keep in mind that the COVID and flu vaccines cannot be co-administered. So the recommendation is to get your flu shot by no later than the end of October. So when the COVID vaccine does come out, you can take that and not have those overlapping each other. We've also learned that the long-term care facility residents, the positivity rate has dropped 70% since July for residents and 60% since the peak time in July for staff. So that's great news. AHCA let us know that they are reviewing differences and they're working with DEM on the impact, and this is mainly for nursing homes, that the CMS regulations will have for nursing home visitation and the state emergency over. The good news is that most of the requirements are similar, but they're going to keep everybody updated and the e-blast changes as they come out. CMS, and this is another nursing home thing, but CMS county positivity. In Florida now, we've clarified that we can use the Florida Department of Health county positivity rates, no longer using the federal rates. The Florida info is more current and may include elimination and duplication. Again, that's going towards nursing homes, not ALFs, but that was just a good bit of info. And one last thing we kind of got from last week's call, this is a good update for everybody with Hurricane Sally. You know, Pensacola, they had, the area had, I believe, 95% of power outages. Many long-term care facilities were operated on a generator, and some of those for several days. So definitely make sure that your plans are up to date. Again, you have plans, you know what kind of contract you have, whether it's a regular contract or a firm contract. And I think one thing AHCA is asking for, and one thing we at Florida Senior Living would learn, Florida Senior Living would love, is, you know, everyone, especially in the Pensacola area, share what you've learned this year. How did that work? How did that work with the generators with COVID? And let's see if we can have, you know, some good best practices for everybody throughout the state. And with that, thank you, Melinda.
Thank you, Jason. Last week, we developed a short survey to determine visitation numbers. And Gail, would you like to give us an update on visitation?
Sure. We were very interested to see how the visitation would go when the visitation orders came out. So we decided just to put together a really short anonymous survey, just asking the members how many folks are coming into their communities. So we've received about 75 responses so far, and the average is about 30%, which is a little bit lower than what we anticipated it to be. There was a couple of communities that reported about a 50% increase or look at visitors, but for overall, about 30%. So if you haven't had an opportunity to take that survey, please do. We just appreciate everybody responding. So that's it. Thanks, Melinda.
All right, thank you, Gail. Well, now what everybody's really been waiting for, we're proud to welcome Kim Smoke, the Chief of Field Operations, State Survey Agency Director for AHCA, and and long friend of Florida Senior Living Association. We invited Kim to join us today to answer questions, and I know you all have plenty. So please type your questions for Kim in the chat box. Kim, welcome to Florida Senior Living Association's Zoom webinar. How is everything going? What do you have for us?
It's very, very busy. So, yeah, well, thank you. And I was so busy last week. I'm sorry I couldn't join you last week. I appreciate Gail inviting me, but had some other things going on last week. So thanks for including me today to kind of go over a couple of questions that you guys have sent to me. And I guess you want me to just kind of go through them, Gail and Melinda, or how you want to do this?
Yeah, go ahead, unless you want to do an update first and tell us everything you know.
Well, geez, really? Everything I know. So,
At least a little bit of what you know.
okay, so a couple of things, you know, the visitation, I make a couple of comments about that, and some of the questions that came in for us to talk about today, some of those responses actually came out of the Department of Emergency Management Order 20009. And as you know, Gail was very graciously participated with the other members of our visitation task force and really did a great work. And we still have conversations about the visitation. So thank you for continue to be proactive with your visitation, you know, with the visitation requirements. Really do appreciate that. It helps us regulatory wise. That we see definitely improvements with visitation and people following the order. And Gail does know this. One of the things that we are working on, because CMS sent out a memo outlining visitation requirements for nursing homes. We are currently trying to work on the Department of Emergency Management Order, making some changes to that because we in the state cannot conflict with federal law, so we're working on doing that, and hopefully we'll be able to get that out. The Secretary Mayhew's goal, as you know, since she's will be exiting our agency on Friday, her goal is to get that done before she leaves. So hopefully we'll be able to get that out to everybody as quickly as possible. So a couple of things I will mention about survey activity. We are resuming our full survey work, definitely concentrating on with our assisted living facilities, any biannuals that we need to catch up with. You know, your licenses were extended for the period of time during the public, you know, as we're still in the public health emergency. So that's helped us from a survey standpoint. So we are getting out and doing biannuals. We're doing revisits. What we're trying to focus on too is revisits, doing those instead of coming on site unless we have another reason to come on site, to do those via desk review if possible. So if you have something pending and you know maybe you've sent information to one of the field offices and you just want to follow back up and say, hey, this has been pending for a few months. It really is just paperwork. You know, here's the information that will help. You know, we can get that done as well too. So we're trying to do those. And actually, we're still getting complaint investigations, so still will be on site doing complaint investigations as well. So just wanted to let you know we're resuming, you know, our survey work and initials. Naturally going to do initials, and we continue to do initial surveys through the high part of our public health emergency during that April, May, June, July, August period of time, because we felt it was important to keep healthcare opening and running in Florida, even though we were in a public health emergency. So we're still continuing and really just kind of ramping back up, doing our full survey work as well. And just as a reminder to let everybody know, my staff are continued to be tested because Curative went away, and wasn't that just Curative spoiled everybody, didn't they? Curative just spoiled everybody because a lot of my staff are complaining now about the nasopharyngeal test because it, like, you know,
Right.
breaks out half of your brain matter. A lot of them are complaining about that. I have to remind them that, you know, your 85-year-old grandma in the nursing home and ALF are getting tested this way too sometimes. So, but Curative spoiled us. So even though that contract ended for us too, at this state, my staff are continuing to be tested. They should still be wearing all the appropriate PPE as necessary when they come into facilities, but just to assure you, they are still being tested. I don't have a mandate from CMS to test the surveyors that are going into buildings. But we are, as a state, at our agency, we just felt that was just, we just needed to continue to do that. I'm tested myself twice a week because I go to the state EOC, but we just felt that that was necessary to give some assurances that our staff are continuing to be tested. Hurricane Sally, thank you so much, Jason, for mentioning that. Stole a little bit of my thunder, buddy. But to let you know, we lessons learned, absolutely. We do have a couple of facilities that we've having to take some regulatory action against because generator was right by the window was up. So, fumes were falling into the, floating into the facility. A couple facilities staff members on site had no idea what their emergency plan was, didn't know how to run the generator. So couple facilities we went to, temperatures were 84, 85 degrees, way above the required of 91. So unfortunately, we have to take a little bit of enforcement action there, but good plan from Jason to really look at, lessons learned. If you have members and counterparts over in the Pensacola area, get with them and say, hey, what'd you learn from this? One thing I'll tell you that we learned is that you got to test and you got to practice and you got to train your employees. If the administrator is not, on site when a disaster happens, there's got to be somebody there that knows what they're doing. And we don't just mean hurricanes. And I think that that's the problem, is that any sort of disaster could happen. And in Florida, you never know. We're the lightning strike capital of the world. And, we have sinkholes as well. We have other things, cybersecurity issues. Cybersecurity month is in October, so you may want to practice that up. But there's a lot of other things that can happen as well. So again, I just applaud you guys for bringing that out to the forefront and saying, what lessons learned? What did we learn here from Hurricane Sally? And take a look at that. So those are just a couple of updates we have here, especially in my bureau as far as field operations and what's going on with that. But I did want to let you know about the visitation order. Excuse me, the visitation order. We are working on that. So we'll go into some of these questions. I think we can just kind of have a conversation about them. That might be the best thing to do. So one thing I just want to talk about is that, for anything, especially with the COVID-19, residents and your family members should continue to consider the CDC guidelines for specifically people of increased risk. As we know, older adults are the highest risk of getting severely ill from COVID-19. In fact, what we found and what research has found so far is that 8 out of 10 of the COVID-related deaths reported in the United States are among adults age 65 and older. And so while CDC, we always refer back to CDC and the CDC guidelines, cannot provide the specific risk level of every activity in every community, especially communities like yours, where maybe small assisted living facilities, large assisted living facilities, or a combination of assisted living, nursing home, independent, it's just a variety of community settings out there. That's why it's important for you as the administrators, owners, consider your own personal situation and the risk for you, your family, and your community before venturing out into the community. And, it does go back to, while, the governor signed, the order for, reopening and restaurants, reopening at full capacity and bars reopening, there are still some city and county ordinances. I know here in Leon County, where I live, and several of you guys live too, we still have the mask ordinance when you go into businesses. So I'm still wearing my mask when I go into a business. When I go to state EOC, I have to wear my mask. So a lot of folks at our agency, although we not a business open to the public, we still are maintaining our own social distancing, wearing masks, and hand hygiene and cleaning, especially high touch surface areas as well. So it's very important that you remember that. So as we kind of talk about some of the questions, and I know I've seen a few things pop into the chat box, I will tell you, I'm not providing any legislative update. I'm sorry, I was not prepared to do that, but we definitely, I know as a matter of fact, right now, my staff and Keisha Woods are having a conversation about the ALF bill and the impact. So we'll be definitely getting something out to all ALF associations as soon as possible. So just wanted to let you know that. So wanted to kind of talk about some of these questions. Residents going out with family members. Yes, they can. And I want to make sure, in some of these responses, I'm going to refer back to the Department of Emergency Management order, specifically 20-009. And that's the one that we are making some tweaks to because of the visitation. But residents can leave the facility, and that's actually addressed in the memo. So I'm not like, this isn't what Kim Smoke said. This is what the DEM order says. Can leave the facility temporarily for things like medical appointments or other activities, which could include, going out with family members and friends. Residents who choose to go out must wear a face mask if tolerated by the resident's condition. All residents have to be screened upon returning to the facility, and you want to make sure, again, to protect the resident from exposure, as well. So, that is outlined in the memo, in the DEM order. So just want to let you know that. Overnight at a family member's house. Absolutely. That's also goes back to how we just talked about what's in 20-009, permitted to leave the facility. Absolutely appropriate measures, again, should be taken and consideration related to the resident's medication handling. You want to make sure about that as well, and care. And again, as the guidelines outline in DEM order 20-009, and really following CDC recommendations, we want to make sure that residents are protected, but that your other residents still in your assisted living facility are protected as well. The current state requirements for testing for COVID-19, as you know, that emergency rule expired. So that the biweekly staff testing is no longer in effect since the 59A emergency rule 20-04 expired. And as we talked about, the curative contract expired on September 13th, I believe. Yeah, September 13th. And so there's no requirement to do that routine every 2-week staff testing. One of the questions speak to continuing with curative, and I know it was crazy, wasn't it, during the long Labor Day weekend? All of you got all these emails from curative about we'll still continue, and made reference to the CMS rule. That confused everybody because they were referencing a rule that doesn't even apply to you as assisted living facilities. I know probably confused everybody. I hate it came out on a long holiday weekend. I do, because I got phone calls about it. But absolutely. And what are the costs associated with that? If you choose to continue with curative, to using curative, naturally the facility would be financially responsible for the associated cost of that testing. And I'm sure a lot of you still have the contact information for curative. So if that's something that you want to do, absolutely reach out to curative. I know we've been asked before about, anything that Medicaid would cover. I definitely encourage you to reach out to Medicaid for any costs associated with, if you have a Medicaid beneficiary, how that would work. I'm not really, I don't know a whole lot about, how the payment structure works, but I definitely encourage you to reach out to Medicaid about that. One of the other questions I was asked, my thoughts on the policies being enacted by our state regarding the virus, testing, opening it for business and schools, etc. I appreciate this question, absolutely. And as you know, our agency's overall goal is to protect our most at-risk population, and we know it's our elderly population out there. And it's an unprecedented time for us, and we will continue at the agency to follow. We ask that you continue to follow any directives that we send out from our agency leadership or from the state, from the governor. Again, as we're continuing to work on those, sending those alerts out, and really just, it's about staying vigilant, I think. So really my thoughts are, it's just really staying vigilant, and it's just some crazy thing that we have to remind people to, kind of your social distancing, stay apart from each other. Don't gather in large groups of more than, 10 or so individuals. And I know even when I go to friends' houses myself, I went to a friend's house for dinner on Saturday. And before my spouse and I went, and these are some folks that we've been friends with for naturally years, and have always socialized with and been part of our so-called bubble. that we asked, well, how many people are going to be there? And there were like 10 people were going to be there. So I said, well, I'm okay to go because, even as what I do, it's just being vigilant and being prepared. And, we're not throwing caution here to the wind. You just want to, be prepared and social distance, wear your mask, if you're going to cough and you don't have your mask on, put your, use your hand or, a Kleenex and wash your hands. Isn't that the craziest thing? We have to have grown people to wash your hands. I think I carry hand hygiene myself a lot. So I think that's really it. And, really just overall, our agency's mission is better health care for all Floridians. Absolutely. And we still want that to continue continue to stay vigilant when we send out alerts and our DEM, our Department of Emergency Management orders, or any executive orders that coming from the governor. So another thing about the phase 3 of the reopening, any additional safeguards that, you could do at a facility to prevent one of your team members for bringing COVID into your facilities. Actually, we definitely still recommend and highly suggest you continue to follow CDC guidelines. Very important. Make sure you continue to follow CDC guidelines. You should continue to assure that all appropriate screening and adherence to infection control requirements to protect your residents and your other staff members. So just again, about staying vigilant. We can't let our guards down at all. And I know a lot has come up recently, and I know Dr. Rifkes has mentioned this along with Secretary Mayhew, making sure, get your flu shots. I actually went Friday afternoon and got my flu shot. I had one in March and got one again here at the end of September. So I think it's very important that we encourage that. I don't know, some properties, some organizations require staff to get those flu shots. So, it's very important that we make sure to do that. I wish I could require that, but working for the state, you're limited on certain things you could do. But I think it's important that that you follow those same adherences to infection prevention and control outlined by CDC. And we've heard a lot of that push about your flu shots. So I think Jason gave a great overview of what Dr. Rifkes mentioned as well about your flu shot and then the vaccine. So,
Hey, Kim,
yes, ma'am.
we went through and condensed some of these questions too, so I think you might be looking at a list that has a lot of repeats.
Okay, I may have. Lord, I know.
So if you'd like, we went through and we kind of put the similar ones together. We can just run through by category if that's cool
Sure.
with you.
That's fine with me.
And then listen, and if it's one that you want to pass on, just say pass, and we'll circle back with Molly or Keisha.
Yeah, because there were a couple of them on here. I thought we probably need to have a larger discussion
All
about
right. Yep.
before I make a
All right.
policy decision.
So we'll do like a long term, or like a long frame lightning round. Ready?
All right.
Okay. For essential caregivers and compassionate caregivers, what type of PPE do they have to wear? Full or just mask?
Well, that is outlined in the DEM order.
Full, right? It's gowns. Yeah, that's what. Okay. All right. Full PPE. When residents are in ALFs and they designate their EC or CC visitors, do they have to include their non-personal relationships like private duty aides or hospice nurses, or is that just for family and friends visiting?
Well, the private, the personal sitters or private aides, that would be separate.
That's what I was thinking too. We just wanted to check. All right, it is separate. Any changes to the visitor screening tools with questions about cruises, traveling between states? I think I heard the CDC is not requiring any kind of quarantine. Is that correct?
Yeah, that's correct. I think it really goes back to what may be instituted in your county. I know some counties still may do that. And I mean, I don't know because there's 67 counties around the state. So I would just check with your county administration to see what sort of visitations they have. I know I've gotten several questions from people that live in New York about wanting to come and visit. Now, they actually, one family member and I have they're coming to visit an assisted living facility, and I'm going to call that assisted living facility and have them reach out to the family member. So,
Okay. All right. So that's all of our visitation questions for the moment. Testing.
But do stay tuned. Some of the visitation stuff, we are looking at that, by the way.
Yep. Gotcha. Yeah, because the Medicaid or the nursing home and CMS. Yeah.
Yeah. Cause some conflict, so we're trying to resolve that.
Yeah, it's no big deal. We'll get there. All right, cool. Testing. If we have a CLIA license and we have not received our Abbott test, who do we talk to?
Okay, so if you make sure that you really do have a CLIA certificate, And I think some of you have reached out to us and have actually sent us a copy of your CLIA certificate. It's a certificate of waiver. You know, just let us know. You can send that to the assisted living unit. You can send it to the our COVID email box. You know, send that to us and we can verify. We do know that, you know, 420,000 of the Abbott Bionex Now testing cards are being sent to Florida. I think they should arrive this week, and Department of Health is working on a distribution plan. The biggest thing is you need to make sure that you do have a CLIA waiver. And we have identified all the assisted living facilities. We have over 3,125 active assisted living facilities in Florida. And we have verified over 300 of those do have a CLIA waiver. And for most part, most of the 300 have already received a device based on the data that we've received. We are working on an agency alert to remind assisted living facilities and several other provider entities on applying for a certificate of waiver, and going to provide you very just information, very specific information about how to apply. So that should help. But I know we have received some that have been sent to us. So just send it to us. You can send it to me. You can send it to Laura McClafferty. Send it to Keisha Woods. To any of our COVID email boxes. We'll be more than happy to take a look at that.
Cool. Who are we supposed to test with the Abbott tests? Residents, staff, visitors, vendors?
Yeah, well, I will say this. Whatever instructions were sent out, and keep in mind, Health and Human Services sent those directly out to assisted living facilities. So
Okay.
with those, there should have been some instructions about testing and a tested methodology. If not, I do know that that is some discussion that we've had here with our agency and with Department of Health. So we will, as soon as we get any additional information about the testing strategy you should use, we'll get that out to you. I'm not sure. I know there was some information sent out early about, oh, you follow the same testing strategy for nursing homes. Honestly, I really just don't know because I did believe that some information had been sent directly from HHS to the assisted living facilities. So we'll get you any information as soon as we can about the testing strategies.
Okay, great. So, so I see that several of you have dropped some additional questions about the Abbott testing into chat. We're going to collect all of those. We'll send them to Kim in one batch, and
Sure.
she'll help us run those down if that's cool with everybody. All right. So moving along to activities, because if I don't ask an activities question pretty soon, people are going to reach through the chat window and come after me. So with the reopening, and don't worry, guys, we're going to answer as many as we can today. And if we can't answer them during the webinar, then we will, I'm keeping track of I've got a big Word document. It's all categorized. We'll send it to Kim. They'll put it together and they'll get as much back to us as they can. So if we don't answer your question, don't worry, we'll get there, I promise. So with phase 3, everything's starting to open back up. Can you talk to us at all about dining, communal dining? Can we do social distancing? Can we use, have fewer people in the dining room? What help us with dining?
Yeah, absolutely. So facility activities and communal dining may resume as long as the facility is adhering to the infection control practices as outlined by CDC. I mean, always refer back to CDC, which would include, any face masks or face coverings, social distancing, hand hygiene, that cleaning between, dining settings. So, instead of having 100 people in your dining room, you're going to have to, maybe offer more services, smaller groups, again, so that you can maintain that. So just like even now, I would tell you, even now, and even in Tallahassee, I noticed because I went out to a restaurant this past weekend after the governor reopened it, the full capacity. A lot of restaurants that I go to are still adhering to the same, practices that they did before. Yeah. Less is more, so to speak, these days. So
Gotcha.
absolutely.
Okay, so there is a light for communal dining, guys. This is very exciting.
Yeah, and I will say this. I think that early on in the pandemic, some of our counties in South Florida, specifically Broward, they shut down everything. And that was a county ordinance in the beginning. I mean, they really shut it down. They were trying to mitigate COVID as much as possible. So that's kind of, I think, how that happened. And I believe it's still stirring around some as well. So.
Okay. Anything, the 14-day no new COVID activity, does that apply to any of the dining and activities, or is that just for visitation and salon and things like that?
Visitation salon, yeah.
Okay,
Absolutely.
awesome. Can we,
But I do want to say a caveat here. I mean, obviously, you know, if you do have a patient that's COVID positive, I mean, although they may be asymptomatic, I think you definitely need to be mindful of that and
Yes.
be
be
very
careful of those persons under investigation.
That's right. That's right.
Those PUIs, guys, keep an eye on them.
Mhm.
All right, can we begin allowing third-party entertainers to come into the building / perform for our residents outside the building?
So, I did see one of the questions was about music entertainers, church services. That is one question that me and Molly and Laura Mack and Keisha are going to be talking about. So,
All right,
that's
so we're
come
gonna
up
pose,
before. Yeah, that's come up before. So we need to answer that for everybody. So.
all right, pending. Just put a note on a couple of these. We had a bunch of those guys, so I just kind of put them all together. So just know that we're working on that.
Yeah, definitely.
Another very common question that's popped up in chat and in Q&A and in the pre-submitted questions. If a resident leaves the facility with family members or, you know, without, you know, let's say they're not necessarily using community transportation just to go to the doctor and back, they're just going out, do they need to quarantine when they come back?
No, that was and that's one of the reasons why we addressed that, because we've gotten a lot of questions about that. It was addressed in DEM 20009 that residents can leave the facility and come back without being quarantined. Because if you think about it, any of your residents that receive dialysis services, they would be on continual isolation if not. So that's why, you know, we really that had been coming up, so that's why we wanted to address it in the DEM order.
All right, great. I have a feeling the answer to this next question is yes, but I'm going to ask it anyways because you never know. Can we resume van rides around the area if residents wear masks on the bus?
Yes, absolutely. So you got your van ride field trips. That's what you
Yes.
we call them back in my day. So
Especially
yeah,
helpful for our memory care units.
yeah, absolutely. So you know, maintain the social distancing, wearing your mask, hand hygiene, disinfecting when you're, you know, getting out of your van. I think that absolutely.
Awesome. All right. Keep it clean, guys. That's what we want to do. Okay, third-party providers and private duty aides, are they required to wear full PPE?
They would be required to wear, I don't know if the answer to that to say yes, but it goes back to your current situation. You know, what type of services are going to be provided. I mean, it's
Okay, depends on the type of service.
it depends on the service. I mean, and it depends on what may be going on with that resident. It's just like for us when we go into a facility, if we're going into the COVID unit, you know, what we wear as far as full PPE is very different than a non-COVID area. You know, we still have to wear PPE, but we're not going to, you know, you got to wear the N95 or the respirator when you're going in the COVID-19 section, or when you're, you know, more, you know, close in contact. So it is going to be, you know, on a case by case, but a lot of that is outlined in the visitation order too, as far as the required.
And these are a couple of similar questions, but just to double check, outside vendors like moving companies, full PPE or face masks?
Actually, we did address that in one of our Q&As. So let me get that Q&A. If you could put that little note and send to me, we can address that. Because I want to say we did address the situation of movers and some alert that we sent out.
It sounds really familiar. I'm pretty sure we've talked about this before.
We have about the movers that came out. Oh, I can't remember when we've sent so much stuff out, but send that note to me. I can send you that back.
Awesome. All right, we have an outside stylist. Gail popped in. Do you need something, Gail?
Oh, I was just going to mention about the movers. I think we did address that a while back.
Yeah.
And they are allowed.
Yeah.
Yes.
Well, I know they're allowed. They just, our folks wanted to know what type of PPE they have to wear. Like, do they need full PPE or can they just do like face masks and gloves kind of thing?
Well, they're not coming in to provide services to the residents, so they need to wear face masks, and their time in the facility is going to be very limited.
Ideally, yes, if they're good movers.
Yeah.
All right. All right. Our salon is getting ready to reopen. We have an outside stylist, so a third-party stylist. Can she come in to do hair if she's screened, answers our questionnaire, wears masks and gloves under the 20-009? Is that okay?
Absolutely. I mean, and that's one reason, and Gail will tell you, we probably answered a million questions about, residents need to get their hair cut. I answered a lot of those from family members. My mother gets her hair done every week, and she has not had get her hair done in 5 months. So that is absolutely why we would address that for resuming barber and beauty salon services.
Perfect. All right. Can our massage therapist come back to the spa?
Well, that's an interesting question, isn't it, coming from an assisted living facility?
Pending? Shall I put pending?
I would say, yeah, Keisha and I did kind of talk about that one a little bit. I mean, when you look at the DEM order, it refers to salon staff. So that would be under the salon services. Massage therapists can resume business, so that would be appropriate. Definitely the same screening that is actually, and whoever asked that question, really go back to, actually it's on page 9 of the DEM order and really read that, because that really goes through what waiting customers, residents receiving services, and what you should wear as far as your, what you should utilize as far as your protective equipment.
Okay. And it doesn't have anything to do, and you know what, I'm not going to ask that question because I don't know, we'll like the answer. So I'm just going to, Kim says yes, guys.
One quick go back, Sandy. Movers question, Kim, I looked it up. It's in the June 26 guidance. It's on question 2D, talking about, you have vendors, contractors entering the facility, and they're looking at plumbers, repairmen, pest control movers, that type of stuff.
Yeah.
They do say the vendors should not come in close contact with the residents when they're in there. The moving items should be done when possible by facility staff. However, the vendors can come in, but they are required to, when they come in the building, they should be appropriately screened and required to wear appropriate PPE. So that's in the June 26 guidance.
Yeah.
Okay.
A lot's changed since June, hasn't it?
Yes, it has.
I knew we addressed it. I just couldn't remember when and where.
All right. How about manicurists? Would they fall under those salon services?
They fall under salon services.
Okay. We have a large spa. Can we serve more than one client at a time if socially distanced?
Now that one, as far as having a large spa, I would want to clarify with that. I think part of our response would go back to what our DEM order says, but that's when I want to kind of clarify, get with Molly and folks on to make sure, because I'm sure this is going to keep coming up. So.
Sure. Are therapy pets allowed to visit?
Now, you know what, I did see that, and I'm a big pet person. I have 3 dogs myself. That is one too that when I saw that, I thought, that's a larger issue that I want to talk about with Molly. Before we send any, before I answer that, I think it's good that we kind of talk about it internally.
Sure. All right. Let's see. We have a couple of more open-ended questions about, phase 3. Some people have said just, what can ALF staff do out of work hours? What's appropriate for them to do? Any thoughts or guidance that you'd like to provide on just best practices for staff off the clock, so we can help keep our residents safe and et cetera?
I think that goes to, each individual property, each individual facility as to, how you want to, educate your employees when they're going out. Yeah, you're right with the bars and the restaurants. I mean, I know there's been some, situations since kids are going back to school and, family members being, in close naturally with their children and then coming into healthcare facilities to provide services. So I think it's honestly, it's just staying vigilant and making sure you educate, your staff on, what if you go out and you're exposed and you bring this in, look at the consequences that could potentially happen. One of the things that, my practice is that I've been maintaining since this is I watch who is in my bubble. There are only certain folks I let in my bubble come to my house, or I go to their house, and anything that I do for sure our restaurants, you know, the people who I've been around. I don't want anybody new into my bubble, in other words. So even, you know, you just have to stay vigilant on that. And I think adhering to infection prevention and control as well. I don't think there's really an easy answer. In other words, I think it's in each individual facility, talking to their staff and making sure their staff are educated on, you know, going out and coming in and, you know, making sure that you continue to screen your employees, and reminders about, you know, now's not the time to let our guards down. You know, we've done so good in Florida. You know, if you don't feel good, you know, don't come to work. You know,
Don't reverse the trend.
Yeah, I mean, like,
Don't be that person.
Yeah, you went over the numbers. I mean, how great is that where we are? And if you just look at the chart, you know, how far we've come. Let's not go backwards. So.
All right, I've got a business operations question. If COVID is not affecting a resident in any way, can a 45-day notice be given for non-payment of rent?
Yes. Yeah, none of that was ever waived.
All right. Okay, so we have actually worked our way through a lot of the pre-submitted questions. I'm going to go through the chat window real quick and see if we've had any that we haven't already addressed. Just very, very quickly. So if there's a situation where a community feels that a surveyor is not following proper infection control protocols, like they're not wearing their mask or they're not socially distancing, what's the best and most appropriate way to get that information to the right people?
Absolutely. Reach out to the local field office. So any surveyor that's coming in, they're coming from one of the field office. So reach out to them first to try to resolve the situation. I've had a couple of calls about that, and I think it's just my staff just, you know, not paying attention to what they're doing, but we had to be very vigilant ourselves.
Gotcha. Well, yeah, I mean, obviously everybody's keeping an eye on this. We want to make sure we're working on it.
Absolutely.
All right, let's see. We'll keep going through that. So just bear with me, guys. You guys have sent a lot of questions in. We want to make sure we get to as many as possible. All right.
I do want to say something while you're looking at that. One of the pre-questions that you sent was about reporting test results to Department of Health. Keep in mind, you have to report all your results to Department of Health, negative, positive, and indeterminate. So make sure that you're doing that. I want to make sure. I know DOH is really wanting those results. DOH is working on more of an electronic portal for you to report your results. But that's all results, and that is very important for negatives, positives, and indeterminates.
Yes, and for those of you guys who may not be aware, DOH did just send out a notice about that recently. It's up on the FSLA website under our testing section. So just because the state has no staff testing requirement does not mean that you have, does not mean that you can stop reporting those results. You have to report the results.
That's correct.
Just do it. Let's just make it easy. Just get it done. Let's see.
Yeah, it looks like we still have a lot of testing questions, you know, related to
Most
Abbott.
of them are Abbott, though. I went through and checked, and most of the outstanding questions, and I told Kim I'd collect all the Abbott-related ones, and we'd send them over.
Yeah, there's still a lot of up in the air about the testing in our other facility types other than nursing homes, about what's their frequency and everything. So,
well, Kim, you know, now that we're getting all these tests, and especially the ones for the, you know, that have the CLIA waiver, you know, some of our communities are saying, great, we're going to use them, we're going to test. They were even saying you can put out, you know, about 40 cards on a table to test that many at a time. But then some of our members are saying, hey, no more testing. We like that idea. So, you know, we're going to send those Abbott tests back. So I guess, do you think that ACA will come out with any kind of guidance about testing since we've got these tests now?
That's what we've been kind of talking about, is what, you know, since these testing devices are coming out, you know, we have nursing home testing requirements. So what we're going to do for our other provider types that are getting these. So just stay tuned for that, you know, and we'll see. I know we've been talking about it, so we're just kind of waiting for any final decision to be made. I mean, and the governor is very adamant about, you know, his priorities about getting these devices out to, our congregate living facilities, even adult daycare centers. So, our intermediate care facilities, APD group, Agency for Persons with Disability group homes, he wants these out, in these facilities. So he's, we've dedicated 420,000. I think he's mentioned that in one of his press release and in one of his press conferences. So
Yeah, and I think there's more coming. I think there's more tests coming. And I think that, the whole curative contract ending, maybe the governor knew that these tests were coming, and, and it just didn't, maybe it just didn't jive, with the dates and all. But so we'll see what happens.
Absolutely. And those come directly from, the Office of the Assistant Secretary for HHS. So they're coming and, they come down and, come directly to the facilities or go, to DOH and working on the distribution. So it's kind of, we're trying to keep track of it as much as possible, but stay tuned for an alert from us to really provide direction on, if you don't have a CLIA waiver, what do you do to get a CLIA waiver?
Well, we appreciate that, Kim, because we did have the Abbott fellow last week on, who was one of the big national sales directors, and he told us, that he could answer the Abbott questions, but that we had to go to HHS, and hopefully they were going to designate a state person that could help us. And so it sounds to me like it's going to be ACA, which is going to be great. So we appreciate that.
Kim's
We're working with DOH. I mean,
Kim's face was
DOH,
surprised there.
DOH is getting the devices, so we're making sure what we've done is gone in to look, because we license, we issue the certificate of waivers because I oversee the CLIA program too. So that's what we're trying to make sure that, everybody, we want to make sure everybody's in line with the law, because we do go in and do certificate of waiver surveys. My lab surveyors do that. So
Kim, a couple more questions about reporting. The DOH reporting requirement. Do you know if that requirement also applies to independent living?
Well, it really, anybody, I mean, and we'd only oversee, if you're not reporting and we're licensed, we don't license or regulate independent living, but in your county, when there is a test, you definitely need to be communicating that to Department of Health.
Okay.
That's a Department of Health reporting requirement for lab results.
Gotcha. All right. So check
Not
with
so
your.
much that you're a licensed provider by the agency. That's just a general Department of Health reporting requirement.
All right. So check with county DOH, but probably yes. Is reporting by phone to them okay, or do you? I mean, listen, guys. I would put it in writing.
Yeah, I think they probably do want it in writing. So I think that whoever asked that question, reach out to your county, because they may have, and I think most counties, do have a way you can report electronically. So, reach out to those and ask if you can do it by phone. I think they want it electronically, but that's not for me to say.
Yeah. All right. And Sue Butler had a great question about who's required to report, if it's the IL staff or if it's the lab. That's probably something that you would want to talk to Department of Health about.
Yeah, I would talk to Department of Health as far, if it's anything independent living, actually please absolutely talk to Department of Health about their reporting.
All right. We're going to go back and do a quick bus question if we could. Can we use the facility bus to take residents to the stores?
Again, goes back to, going out for outings, making sure you got your mask, you're using hand hygiene, when you come back, cleaning, making sure you're sanitizing the bus in between, uses.
Do we have any contact information at HHS if people are having a hard time with them, or should we just put that in the Abbott list of questions?
I think that there some contact different when you guys talk to the Abbott guy. I want to say, well, I think I got some information on as far as contacting via HHS. The HHS. Yeah, it is HHS. I may have some. If you could send that to me in an email, I think I can get you some contact information for that.
All right, I'm going to add Doug. I'm going to add that to our Abbott list.
Yeah.
Yeah, that'd be great, Kim. Thank you.
Sure.
All right. We have, and please don't hold me to this on my life, but for the most part, we have covered all of our pre-submitted and live submitted questions. Yeah. So unless you want to expound on levels of PPE, expound on how far is too far with social distancing. If you have any other thoughts that you'd like to share with us, but for right now, unless more questions come in, which they haven't just yet, and please do make sure if you have a question, drop that in the chat window or the Q&A box. We're not able to actually pull attendees in right now, so drop it in the chat, drop it in Q&A, drop it like it's hot. We'll get those questions answered. But for right now, we're actually we've caught all the way back up.
Yes,
And
Sandy.
we'll also put out all the questions and answers too.
Mhm.
Kim, we'll go back and we'll listen to this recording over and over to get all your correct questions and answers.
Absolutely. But send those to me. And, you know, some of the stuff on the testing and the Abbott Binax Nows and the testing strategies, definitely we'll get you any information we have on that as quickly as possible. The music entertainers, them and church services, we'll get, you know, take a look at those as well. And the pet therapy services will, you know, I know that's definitely something we need to address for a lot of these, really for all of our provider types we need to address.
Cool.
Yeah.
All
All right, guys. Well,
All right.
I'm covered on my end.
All right. Thank you so much, Kim, for being with us today. You've been so helpful to all of us. And Jason, I think you have the in case you missed it slide.
Yep, thank you. So as usual, here's our in case you missed it slide. These are hot links to recent documents of interest. You'll be able to click on these once we send out the PowerPoint. And I think we're going to hopefully include several of these for you to look at. Take a note what we added here, the governor's executive order implementing phase 3 of Florida's recovery, and the DOH information regarding the mandatory reporting of test results. So that may have some information, especially regarding the lab results. So with that, thank you, Melinda.
All right. Well, thank you all for your participation today in the call. And we plan to do this again next week. Thank you, everyone, and good luck. Please do not hesitate to call FSLA if you run into any concerns or you have any questions or problems. Thank you so much.
Thank you, Kim. Thank you, everyone. We appreciate it.
Have a great day.
Thank you. You
Okay.
too.